Over 170 people a year in Scotland suffer a serious spinal injury, most of them in some sort of accident. To find you have permanently lost the use of so much of your body is an absolutely devastating blow. Only with the support of a wide range of organisations and professionals can people adjust to their new circumstances. Queen Elizabeth National Spinal Injuries Unit at the Southern General Hospital in Glasgow is responsible for the management of all patients in Scotland. Dr Alan McLean, the lead clinician at the unit, explains how our charity Spinal Injuries Scotland is involved.
Well, Spinal Injuries Scotland have been absolutely critical in this. What we've done is we've engaged them at the beginning when the patients are in the unit, in that first 3 months, 6 months, but many people with spinal cord injury now live for 30, 40 years, so the actual, the original admission might only be 1 or 2% of their remaining life. We see Spinal Injuries Scotland volunteers there at that point that are helping the patient through the difficulties of initial injury. But what happens after that is the volunteers also come along to our clinics, not just in Glasgow but throughout Scotland. We go up to clinics in Inverness, Aberdeen, Dundee. Whenever we go, we'll find there'll be Dougie, one of the other volunteers, will be there in their blue polo neck shirts, quietly getting on with it, speaking to patients, counselling patients, advising them, maybe backing off, maybe it's too early, maybe it's not appropriate. But at times it's incredibly useful for the patients to speak to somebody who's been through the system, and the SIS volunteers are there to offer support, advice, counselling, and directing people on through the maze of some of the benefit system and the local authority issues that people have to deal with when they're badly paralysed.
Nathan McQueen was a promising 17-year-old rugby player who suffered a serious spinal injury in a motorcycle crash in 2009. Despite his injury, Nathan has continued to take part in sport. He has competed in competitive weightlifting. Unfortunately, he missed out on representing Scotland in the 2014 Commonwealth Games due to an injury. His main focus is now archery.
So what's the most important thing that you think Spinal Injuries Scotland, like peer mentoring, provides people with?
It's support more than anything else. I know it's support, information and advice, but it's the support. Even if it's just visual, I feel I benefit from that the most, and I think there's quite a few others as well who feel the same.
Spinal Injuries Scotland provide a wide range of services, including peer support volunteers, welfare and legal advice services, a magazine and a website, together with our adapted accommodation at Clobber Farm, allow us to encourage those with a spinal cord injury to realise that life has changed but not stopped. Your support enables Spinal Injuries Scotland to make a positive difference to those coming to terms with a spinal cord injury, whatever their target or goal.